16 weeks into my second pregnancy, I had a miscarriage while I was home by myself. I like to share this because it shows that even a psychologist doesn't know best. About 2-3 weeks later, I was diagnosed with breast cancer. The things that people say after being diagnosed with breast cancer are really interesting as well. And it was sort of like, what do you mean? Nobody dies from breast cancer anymore. Fight this thing, you're a survivor, all of these words that I was sort of like, I'm a warrior? Like, wait, what do you mean? I just want to lay here. Like, I felt like I'm so not like suiting up for war right now. Like, I just like need a minute.
All right. How you feel?
Good.
All right, good. Well, again, thank you for being here. And welcome for anyone that just joined the show. I guess we're starting this thing off officially, even though we've been talking for the last 5 minutes. I would love if you introduced yourself just so people can get a little bit about you, and we'll get the ball rolling.
Sure. So thank you so much for having me. I know we've gone back and forth trying to get this together for some time now, so I'm honored to be here. My name is Jessica Zucker. I'm a Los Angeles-based psychologist, and I specialize in women's reproductive and maternal mental health, and have done so for over 15 years at this point. Most people assume that I specialize in this because something happened to me. And that's safe to assume because a lot of therapists specialize in things that happen to them, and it makes sense that our life experiences can inform our choices professionally. However, in my situation, I have a background in public health. I worked internationally in women's rights and women's health for several years. And when I decided to pursue my PhD, I wanted to somehow marry my background in public health with my interest in the clinical work, which meant that I specialized in pregnancy and pregnancy loss and infant loss and postpartum depression and anxiety and so forth. So at that point, it was all theoretical for me. I had tried to read all the books. I had tried to take all the trainings and go to the consultation groups and be as informed as I could be. But it wasn't until 16 weeks into my second pregnancy that I had a miscarriage while I was home by myself. Inevitably, invariably, this transformed my personal life and my professional life. So for years upon years, I had been sitting across from women, hearing about the sense of self-blame and the sense of body shame and the stigma and the alienation, all of these things that, again, I was informed about theoretically, but not corporeally, like not from my own body-based perspective until I was. And this led me to start a whole thing. Basically, I had this loss. The details of my loss are sort of unparalleled in their drama and the trauma of it. We can get into it if you want to. I just don't know. Yeah, if a trigger warning, I don't use trigger warnings, but some people like to. I started spotting the day before. I went to my doctor. Everything looked perfect. And the following morning, I was sort of roiling in pain, knowing there was no way there was going to be a positive outcome. My husband took my son to school. My husband went off to work. We can get back to that. I sort of obviously wish that I had asked him to stay home, but he was working on something important and I thought he should go, and there was nothing that he could do anyway. And midday, I was trying to get myself ready to go see another doctor to get another opinion about what could be happening here. And I went to the bathroom and I felt, which I now understand, I was laboring, but I felt like I was going to have some sort of panic attack or anxiety attack, which I don't normally have. So I just was kind of spinning. I want to say I was out of body, but it was the opposite. I was two in my body that I sort of wanted to be able to escape. And then I sat down to go to the bathroom and the fetus fell from my body. So thankfully, most stories do not end this way. Not that it's any less traumatic to show up at your doctor's office and find out there's no heartbeat. But the physicality, the mess of it all was so tragic and tremendous and overwhelming. I was by myself. I was too scared to call the paramedics. I didn't want like random men running through my house when I had a baby between my legs. So my doctor talked me through how to cut the umbilical cord by phone. And so I had to kind of shimmy myself to where my, eyebrow trimming scissors were in order to detach myself from the fetus, which was so psychologically important. It was so deep and so unbelievable. It's still, just even talking about it now, even though it was actually 12 years ago, it doesn't seem possible that something like this could happen. So I cut the umbilical cord and I promptly began to hemorrhage, as one does when there's still placenta inside. My husband got home as quickly as possible. We took the fetus in a bag to my doctor's office. And then I had to undergo an unmedicated DNC. So I suddenly understood too well what so many of my patients had been talking about for years, and decided that culture needs help in this regard. Well, in lots of realms, of course. But the silence, the stigma, and the shame that swirl around these topics of grief, pregnancy loss, pregnancy after loss, life after loss, navigating sex after loss, like all of it, I felt emboldened, like I felt almost required to use my voice and sort of create something that would hopefully make a dent in the cultural conversation that wasn't loud enough for me.
Outside of the entirety of this scenario, which is obviously completely traumatic, what do you recall the first couple of days or the first week of that? Like, where was your mindset and how did you get through that?
That's such a good question. I haven't been asked to think about that in so long. I think because I was already a mother, I desperately wanted to hold on to my sanity. I wanted to present myself as, authentic and sad and befuddled, while also being able to obviously care for him and cuddle with him and giggle with him and play with him on the floor and stuff. We decided it was wisest to tell my son, we thought mommy was pregnant, but it turns out she's not. Like, we just left it that simply. I was very visibly pregnant because I'm small. And so 4 months in, I think it was very obvious, but we just decided, since he was young enough, and we of course consulted a pediatrician, that was sort of the wisest in terms of his development. I felt I was so, well, trauma is so stunning, right? It's like you're just like stuck in midair. Like you're just like, wait, how do you even begin to process that I was 4 months along, that I just like had to see this fetus, that I had to be in this pain, that I was like hemorrhaging, and then had to go through more physical pain to get rid of the placenta. And then I'm just on my way home, no longer pregnant, now with antibiotics, and like staring at the wall. you know? So of course I did feel loved. I felt supported. I felt that people wanted to be there for me, but I really did understand, unfortunately, all of the rumblings from my patients, from the research, that no matter how much people want to be there for you, the platitudes that begin to roll right away can be incredibly off putting and isolating. So I tried to remain present in my life, but I don't think I fully was for a while. In my first book, I talk about my sort of back and forth struggle with my sister, uh, talking about like how much time should I take off from work? How do I let my patients know about this? It's not like I have HR since I'm in private practice, so it's not like somebody can actually handle this for me. So I needed to reach out to everybody and let them know. And so I took only the remainder of that week off. And I like to share this because it shows that even a psychologist doesn't know best. Like what the heck was I thinking? On the other hand, though, the way I saw it was, number one, I didn't want my patients to worry about me because that's not what they're here for. So if I couldn't show up for them and took off all this time, would they begin to wonder, if something even more was going on? And number two, I'm not that keen on laying around in my grief, like laying around in bed and just kind of trying to pass the day by sleeping or whatever. That's not my style. And actually, that felt worse. And so it's not like I went back to work for a distraction, but I am so passionate about my work. I love the people I work with. And so, being engaged in that way did take me out of myself and kind of put me in a position to be thinking about somebody other than myself.
Did you find a balance in, I suppose, living and grieving from what I'm hearing? Because obviously, you could stay put, stay still, which may work for some people, and allowing yourself to feel it. But it seemed like you felt the need to continue living life at the same time simultaneously. So is it a balance of living and grieving at the same time so you're not putting it off?
Yeah. I wonder if it was a balance. It was probably more like a roller coaster of like, you
Yes,
know,
I say balance very loosely.
yeah,
It's a
like maybe,
it's a seesaw. It
right,
never
right,
fully
right.
balances, but
Yeah, like maybe, one day I would be a mess, and then maybe the next day I would be engaged enough with my son or something that but I think I was floating. Like, because as we're talking about this, and I do include in my first book a vignette of like, I went to get a manicure pedicure, and I included this on purpose, even though it sounds so silly. It's like I went to try to do something that is just kind of, you know, normal or everyday life ish, whatever. And I called my husband when I got there and I was like, I don't know how I just got here. Like, I
Mm.
literally felt like, and it could have been the hormones. It could have been that like my sleep was fully disrupted and the exhaustion was immense. I don't know. But it was terrifying to not be able to sort of track turning onto Sunset Boulevard and turning onto whatever. I didn't know how I got there. So he came and met me and sat with me to kind of get me through. And that was, one experience where I was like, okay, I get that you tried to live a little bit, but it might be wise to stay closer to home for a while. And so, my husband sort of took on the role of, I didn't want to be at preschool. Like I didn't want to have to go pick up my son if I could avoid it. And even like mundane errands and stuff, I just didn't want to be at a grocery store. I didn't want to be at the gas station. Like I didn't trying to do everyday things felt too difficult, like molasses and like sounds were too loud. Like I felt incredibly sensitive.
Yeah, and that floating comparison, obviously I don't have experience in what your experience was. Even it's always interesting to me because when there's obviously a lot of women in this world that have had miscarriages, but at the same time, no matter how many there are, everyone still had their own individual experience. So you can find similarities and camaraderie and comfort in these conversations, but everyone's experience is still uniquely yours. I wonder the other side of it, where I feel like obviously you carried a lot of the burden because you had this experience, but then there's your partner, the partner on the other side, and I'm always so interested and curious about how that dynamic works out. And of course, this again is unique to you guys, but how important is the role of the partner as someone who's obviously grieving as well? They just lost a child, not as physical, and didn't have to go through it as you did. But what is that dynamic between the partner's role in supporting the woman in this situation?
Yeah, that it is so unique to each couple. I'm guessing. I hear so much about this in my practice, feeling like the woman bears a majority of the burden, which of course, because not only physically were you pregnant, now you're not pregnant, now you're bleeding, my milk came in, like it's like the physicality of it just goes on and on. I think my husband, and I think men are sort of taught to do this in our culture, it's like he was worried about me. Like the focus was me, the focus was our son. And it wasn't until months later that I could, we could sort of lay there and look at each other and really sort of try to open up, like unpack, like, where were you? Because I didn't feel like we were fully together, and that's when he revealed that, like, he thought he could lose me that day. So yes, it was, of course, a huge loss for him to lose that pregnancy. But I think seeing me hemorrhage, seeing me in this medical situation, seeing how emergent and extreme it all was, I think he was very fearful that he would lose the mother of his child. But I do think there needs to be more room, and I haven't written a lot about men and miscarriage grief, but I do think there needs to be a lot more room to talk about what are you actually feeling? Like, yes, focus on your wife or your partner, yes, check in as much as you can and be available to do all the things, but like, how are you actually feeling? And I just don't think men are even asked that enough. And then I don't know that they even know the answer once they are asked, because they haven't been asked it enough over the course of their lives.
Yeah, and I feel like if I were to try to understand, obviously the priority, as you just expressed, goes on you, goes on your partner, goes on your wife, goes on your kid immediately. I think that's like the second nature, as it should be. And then I would imagine there'd be almost a guilt attached to it to even contemplate how I feel as the man in this situation, because I didn't go through this. I mean, I'm part of this because it's still, you're my wife, it's my kid, but I could imagine a little bit of a guilt being there to be like worried about myself or even have anyone check in on me. So I feel like it's again, another seesaw thing there. It does sound like something that would come down later, because obviously the priority is you and the priority is your family. So I feel like that is more of like a delayed discussion, as you just expressed. And that sounds like a good path to me, but what the hell do I know? And again, I find it so interesting that you have this, the clinical and expertise prior to your experience. Did you notice any any avenues where you felt either the need or the desire to improve your own practice outside of the philosophy that it seemed like you told me? Were there any holes, if you will, for lack of better words, after you had this experience, like, oh, outside of just understanding it more now, there are modalities or practical methods of getting through this that you experienced that you didn't realize prior professionally?
Oh, that's interesting. I think that I don't know. I don't know if modalities per se, but I do think that I became sort of emphatic about helping people not judge themselves, helping people grow their capacity for self-compassion, to, get mad even at culture that there wasn't room to talk about these very important experiences. So I think for some of my patients, it was too scary that this happened to me. And one in my first book, I talk about her response to me. It's like, if this could happen to you, does this mean this could happen to me? Which brings up a very important point about trauma in general and wanting to scurry away from grief as quickly as possible, which is this notion that somehow it's contagious, that pregnancy loss is contagious, that other forms of death and loss are contagious, that diagnoses might even be contagious. And so as much as I tried to kind of talk to her about what's underneath that, which is total understandable fear, but also magical thinking, I still think that she felt compelled to kind of get away from the situation. And I respected that. But on the other hand, so many of my other patients were so heartened. I mean, they didn't want to say like, "Oh, I'm so glad this happened to you because now you understand me." But they were, because I could, and because it did deepen the connection. So yeah, I think what it did more so than sort of shift the way I worked clinically was to kind of find my own self-compassion and hopefully sort of model it for them and or impress it upon them. But I think that because I had always loved writing and was already freelance writing, I think it was like all of this sort of passion and insight and whatever kind of got turned to the page. And I wanted to, reach as many people as possible. And so in 2014 is when I launched the I Had a Miscarriage campaign with my first New York Times piece. And again, it's not like I had a plan in mind. I didn't know I was starting something. I just wanted to say something and I wanted it to reach the masses. And so, and that was a clinical risk, I think, because I did share a lot of my story in it. And so previous patients could get their hands on that piece. Potential future patients could read that piece. But I felt like the risk was worth taking, because I wanted to model that even a psychologist, even somebody who specializes in this, can be taken down. And then what do we do with this? And how do we incite and provoke, a cultural conversation that upends the strident trifecta, this kind of, outdated, antiquated silence that surrounds these experiences.
Yeah, and to me, it almost simplifies it in many ways, because when you look at both sides of that, there's the clinical aspect, and then there's you just sharing your experience, which they kind of go hand in hand, because it can be clinical, but it's not, because it's more personal and real. And then it just seems like it's really tackling the obstacle that, correct me if I'm wrong, is one of the biggest. There's many things that come with this, of course. I'm not trying to pigeonhole it, but it's one of the biggest hurdles just getting over the self-blame and guilt? Is that the most common feeling that gets intertwined with this? Is that silly to say?
Yeah, I mean, the research shows that, unfortunately. And I think that's why I was so angry and so sort of revved up and wanted to, get on a soapbox about this, because it's hard to sleep at night thinking that 1 in 4 pregnancies will result in miscarriage, about 1 in 160 in stillbirth, and so on. And, those who need to terminate for medical reasons. There's so many people experiencing these types of losses. And so if they're sitting there blaming themselves or thinking they did something to deserve this, or they didn't do something that made them deserve this, or maybe it was that sip of coffee, or maybe it was that sip of wine before they had, even known they were pregnant. All of these things made me lit a fire in me, sort of like, this is unacceptable. Yeah. So, I mean, one other thought though that I just had about your clinical question. I mean, I do wonder sometimes, the boundaries I think got blurred for the first time in my career. And I think about that still, because I had to walk in now not pregnant. And they then also had to show me empathy and ask how I was doing. But then, I would kind of quickly turn it back to them because I didn't want to spend a whole session on me. And then they had to sit there wondering, is she going to try again? And how's that going to go? So it was like we were in each other's lives in such a different, sort of more intimate, who's who in here. I mean, I'm pretty confident that I held on to my therapist chair, and that I was able to kind of not compartmentalize, but just focus on myself outside of the office, and focus on them when I was there. But it did blur the boundaries for sure.
Yeah, and it seemed like it blurred the boundaries in a positive way outside of such a terrible experience. If you're opening the door for other people to have this discussion, and if you're crossing lines from a clinical aspect and a personal aspect, I think that's huge. And again, it's so wild to me that, as you mentioned at the top of the podcast, how a lot of people get into certain professions because they have this experience and you didn't even have this experience, and then it happened.
I mean,
it's so eye-opening.
I know. And then more stuff happened. So I don't know.
There's always more stuff.
A series of unpredictable events. At least that's been my experience as of late. So,
and I would love to get into some of those other experiences, but before I do, in regards to that, a little bit about that process of relieving that guilt, does that just come with conversations, with hearing other stories and working through it, understanding that it happens to other people? Is that part of the process of kind of coming to grips that, you can let go of some of the guilt?
I think so. I mean, so for me, I found out within 2 weeks' time that there was a chromosomal abnormality. So that's why we brought the fetus to my doctor's office, so it could be tested. She could be tested. And so for many people, finding out the medical reason behind the loss can be grounding. It doesn't mean that it's necessarily reassuring, because, you may worry that it would happen again, but at least you have an answer. And I've found over the years in my practice, it's the people who don't have a medical or scientific answer who kind of continue. Again, we can all continue to spiral, but not having concrete answers can provoke that all the more. So, but maybe it was something I did, but maybe I shouldn't have worked out. Maybe I shouldn't have masturbated. Maybe I shouldn't have, had an orgasm, had sex, whatever it may be that people worry that, they did to cause it. But here's my thing when it comes to this, and hopefully my patients hear me and feel this and digest it and really take it on board. My sense is that women are blaming themselves because if they did something wrong, then it means they can do something not wrong the next time. So I think it comes down to a sense of control. And none of us like to admit or realize that most things in life are out of our control and that most things are sort of unknown. And so there's this almost like fastidiousness in subsequent pregnancies of like, okay, I'm going to eat this. And I read this book that says I should do this. And I'm going to sit like this. And I'll only exercise like that. Does that change the outcome? We don't really know. I mean, a majority of miscarriages are chromosomally related. So you can do everything right and still have an outcome that you're not happy with.
Yeah, and I correlate that. It's, much different things. But when my father died when I was 12, I started, a lot of my processing of the grief happened many years down the road as I became a man. And then I started thinking about how when you lose someone, it can take you down many different paths, but it could either make you like fearful or grateful in many ways. As overplayed as that word can be and nauseating as it can be sometimes, I think it holds a lot of power. But you can either be more fearful, oh, this loss may happen again. Oh, I might lose my mom. So my sister, I'm aware my sister can die. This could happen. That could happen. This could happen.
Yes.
And it can take you down that path, which is just kind of neurotic. And then it takes you down a spiraling case of what can happen when it's just kind of like, okay, yeah, this can happen. This is how it happens. This happens all the time in many ways. And not to diminish the idea of death or these horrible situations, but it kind of just humbles me in many ways. And especially at a young age, the way my dad died in the World Trade Center, I was like, oh shit, like this can happen and it could happen to me. It's not just a headline across the world that I can't personally be attached to.
Exactly.
And then, so it's either the path of worrying like, oh, what can I do? And then all of a sudden you're not even able to really live life anymore because you're constantly worrying. Or you take the other choice of just somehow finding a way to accept the reality of the world, that things happen. Sometimes there's no reason for it or there's nothing you can do about it. And at the same time, you could either just worry about something that hasn't happened yet, even though it has happened to you, or you can live life the best you can through gratefulness of what's here right in front of you and just do the best you can without fear.
Amen to that. And I think though, like, if only
easier said than done.
Well, that's the thing. Like, if only it felt like a choice, like.
Yeah.
I think, unfortunately, anxiety, and it sounds like you were able to navigate through that, with a lot of like logic, maybe by choosing a certain path that felt more productive to you. But I think, I don't know whether it's sort of a swirling of hormones and postpartum loss or whatever. I do think this kind of unending situation of what if. And I think also, when someone dies, yes, it's finite. They're no longer here. And then it can set off like, but what about all the other people in my life? I think with pregnancy loss, what makes it so unbearable in a way is wanting to get pregnant again, because you're going back to that sort of like proverbial alley where you lost it and now you're going to try again. And then you have to navigate 9 months of waiting to know if everything's going to be okay or not, and no amount of like psychics or therapists or anybody can reassure somebody of that.
Yeah, it's terrifying.
But I do hear, if I'm with patients long enough to then see them on the other side of whatever they end up with, not everybody ends up with a healthy pregnancy, but a lot do. And like you, they say, even though I wish none of this had happened, I'm incredibly grateful for this baby that I do now have, So, yeah, I wish I felt like I had that choice more accessible to me sometimes, because I find myself anxious at times and really trying not to make life decisions from that place.
Right. Yeah. Again, it's a much easier said than done. This is coming from someone who have not had this experience. So, I mean, you mentioned again the other life things that's happened, and feel free if there's anything you feel like getting off your chest in regards to what we just discussed. That was an
That
accident.
was good.
That was not on purpose. I promise you this. That was not on purpose. For anyone that has no idea where we're leading on to this, as soon as I said it, I was like, "Oh shit, that's not what I meant."
Well, that was going to be when I thought about writing a memoir, a second memoir. That was going to maybe be the title, actually. Yeah.
Oh wow. No, okay, so I'm in line. All right, now I don't feel as much of an asshole. Well, I mean, okay, so this topic relates to me. My sister Gina, she had breast cancer last year and had a vasectomy, and she had it early stages. So as it was still an interesting situation. She handled it unbelievably, but she was fortunate to get it very early.
Sure.
So the discussion around breast cancer, obviously, it's a very prominent discussion. It's very common, and we connected years ago, and you were going through a battle of your own. Correct?
Exactly. So my first book came out. My first book, I Had a Miscarriage, a memoir movement, came out in March of 2021. And then about 2-3 weeks later, I was diagnosed with breast cancer. So, by that point, I had processed my miscarriage for many years and written on the topic endlessly. So it's not like I felt like the two traumas got mixed up together. But this was basically the last thing that I ever thought would happen to me. I'm the first woman in my family that's ever been diagnosed with breast cancer. My family is, knock wood, incredibly healthy and vibrant, and I take great care of myself. It was just, I had felt a lump. I'm good friends with my OBGYN, so we talked about it, and then I had her feel it, and she thought, this is probably nothing, but it's time for your mammogram anyway, since I didn't go to my mammogram in 2020. Yeah. Because of COVID. And yeah, there's sort of no words for how much this turned my life upside down. It sort of sadly made my miscarriage and my book that I had just put out into the world feel a lot less significant. And I am not one to compare traumas or compare losses, in no way. But I was just like, wait, are my kids going to have a mother? Like, I'm in my 40s and I'm being faced with the potential of dying. And what was interesting too, when I would say that to my family and friends, everybody, we didn't get into the platitudes, that are, spewed after pregnancy loss, but the platitudes or the things that people say after being diagnosed with breast cancer are really interesting as well. And it was sort of like, what do you mean? Nobody dies from breast cancer anymore, and the first words were sort of like, you're a warrior, you're going to beat this, you're going to like fight this thing, you're a survivor, all of these words that I was sort of like, I'm a warrior? Like, wait, what do you mean? I just want to lay here. Like, I felt like I'm so not like suiting up for war right now. Like, I just like need a minute, So I found that really interesting. I do feel like if I ever write another book, I will take that on, because I don't think that women should feel forced to be at war with their bodies. I think they already struggle enough with them. And I also don't like the implication that if somebody does pass away, that they didn't fight hard enough, or that, they didn't get into that battle with enough verve. Yeah. So here I am, though. You know,
Amen.
months after I was diagnosed, a mental health publishing company came to me and asked me to write a second book. And at the time, it felt almost like a lifeline. Like I was like, you know, if I have something to focus on and work on and can continue to expound upon my passions and, you know, spread the gospel or whatever, maybe I should, you know, and I definitely have had periods of regretting saying yes, because I don't think I realized what the journey would feel like through my reconstructive surgeries and stuff, and how much time and energy it would all take up. But I did, and it's here.
Normalize it.
Yes. And the subtitle is Upending the Silent Stigma and Shame That Shape Women's Lives. And so it's really all about the things we've been talking about today. You know, just it's time that we normalize talking about hard things. That's the book in a nutshell.
Well, I love that. I mean, of course, in alignment with my podcast in many ways, is normalizing. It's even though it's focused on death, grief, the afterlife. You know, a lot of stigmas tend to come up, which I think we just discussed throughout these last 45 minutes, and it should just be not essentially normalized that it's normal, because what the hell is normal in this weird world that we have, but just the fact that we can talk about it. And
exactly.
I think, you know, sometimes we don't have to overcomplicate things, and just by opening our mouths and sharing, and the power of stories and the power of listening and the power of opening our minds to different perspectives. Even if even for me, I'm not going to have personally myself physically going to have a miscarriage, or I'm not going to be able to physically experience that, but it's still eye opening to understand these situations. God forbid my partner or anyone else I know, or it's just knowledge about the world. And I commend you for having the courage to share these experiences with you and kind of put yourself in that soapbox, as you mentioned, for the benefit of hopefully other people, which it seems like you've been able to reach.
Thank you so much. Yeah. I mean, the truth is, like, in this next book, I do mention breast cancer, but I don't get deep into my story. I don't see myself writing a whole other thing about breast cancer. I think that it was... luckily, plenty of people are talking about it. I don't feel like called to get on another soapbox about breast cancer. And I still think the truth is, like, I'm navigating it today. I mean, because I have to be on estrogen blocking medication for 5 to 10 years. And so it feels like it's in the rearview mirror in many ways. But it kind of isn't. Like, I have to see my oncologist, you know, every 3 months. So for me, that doesn't feel rear view mirror enough to want to sort of, you know, be a change maker in society about it. I still feel too tender, I think, about that.
Yeah, I mean, even outside of the medical protocol, I mean, it's going to be something it's not going to go anywhere regardless in many ways. You know what I mean? The effect I'm sure it's had on you.
Exactly.
Well, okay. Well, I thank you for making this happen. I know it's been a while since we connected, and you've been going through a lot. So I'm glad you're still here, smiling, looking wonderful. So I just want to express my gratitude for taking the time to speak with me, share this. It's going to be extremely helpful for anyone that's listening right now. And I'm honored to have the opportunity to connect with you.
Me too. Thank you so much for having me. And thank you for, you know, staying on me and making sure that we did this, because it was really wonderful. Thank you.
Of course. And for anyone, as usual, which I think most of you already know, I will put in the show notes links so you could find her, and as well as her book, which I'm not sure when this episode is going to drop, but it launches April 22nd, yes. Correct? So it should the link will be in there for you to grab it whenever you're listening to this, I'm sure. And I'm sure it'll be a good one. So again, thank you so much for anyone that's listening. Thank you for tuning in. And until next time, ciao. Thank you so much for tuning in to another episode of Dead Talks. Please do not forget to hit the subscribe button and also the notification bell. That'll give you updates as to when we post a new video, more episodes, and more content in general. We are streaming in all the major podcast platforms, including Apple, Spotify, iHeartRadio, Pandora, and all that. And also find us on Instagram at Dead Talks Podcast or www.deadtalks.net. Thank you so much.